At this time, 7:23 p.m., I now call the work session to order. We will begin with a presentation on the homelessness, and we have some people here. Perfect timing. I hope they're here. They may be out in the hallway. Danielle Meister and Kevin Lindemood. Do we have any guests out in the hallway? Thank you. This is perfect timing. I think this will be very helpful. Hello, how are you? Thank you, thank you. Hello, we have special guests tonight. We have Assistant Secretary of Homelessness Solutions, Danielle, is it Meister?
Yes.
Meister, thank you very much. And we have the CEO Healthcare for the Homeless, Kevin, is it Lindemood?
Lindemood.
Lindemood,
Yep,
thank you
close.
very much. Thank you. And they are a special guest here from, as what we would say, across the bridge. Thank you very much for bringing your expertise. It's a very poignant and perfect timing as we pivot into trying to make solutions for these very deep problems we have here in Salisbury. Thank you. I'll turn it over to you.
Great. Well, thank you so much for having us. We really appreciate the opportunity to join everyone tonight. And wow, what a crowded room.
Yes.
We had to hang out in the hall. It was so packed in here. So it's always exciting to see public input in the government process, right?
Yes.
So I'm Danielle Meister. I'm the Assistant Secretary for Homelessness at Maryland DHCD. So my job is literally to try and end homelessness in Maryland and to lead a statewide strategy around that, both working with our local communities to try and align our response systems and find new funding to support the different programs we need to implement, but also working across state government to make sure our state agencies are working effectively together too. And so I'm really excited to come and join you tonight because we have been making a lot of progress on homelessness in Maryland. I know it doesn't always feel like it because it's increasingly becoming a more visible issue, but we've been really successful over the last decade of reducing homelessness by about 28% and 42% for folks who are living on the street. So we're seeing a lot of progress. And one of the big things that contributes to that is permanent supportive housing. So we're really thrilled to talk to you tonight about what's the state doing, how can we support your local community, but also really commend the work that Salisbury's done to establish its own locally funded program that is rare for a small, rural city. There's not many of them out there, and it's such a critical investment, and in particular right now because we're facing a lot of HUD cuts that I want to share about. So I do have some sort of more formal remarks.
Yes.
But I wanted to just share that, as of this last fiscal year, the Lower Shore, so all three counties together, served about 1,000 people who experienced homelessness over a 12-month period. Of those, about 120 people were what we consider chronically homeless, so they had a disability, they have at least 12 months of homelessness within a 3-year period. They're who we would consider to be the most vulnerable, folks who, without some kind of housing intervention, are going to remain homeless and probably on the street in that kind of setting. So we have, a significant challenge out here, and obviously we know that rural communities, small communities don't always have the same resources as urban areas. So one of the things we do at DHCD is supplement with state funds, a lot of which is shelter, permanent housing, but we simply just don't have enough to meet the need. So that's one of the reasons why we really appreciate the work that Salisbury is doing to help support that at the local level. That is something that's really special and unique about your community. So I just want to comment on how supportive housing is effective in solving homelessness. So we know, we have the data from decades of work now that really shows supportive housing has the best positive outcomes for folks in terms of housing stability. Transitional housing, less than 50% of people exit to permanent housing, and many more of those come back into the homeless system because those permanent housing outcomes weren't stable. Where we see the best result is actually with rapid rehousing, where about 85% of people exit to permanent housing and stay there, and for permanent supportive housing, 95%. And when we think of supportive housing, there's a couple different aspects of that, right? There's the housing affordability For most people who are chronically homeless, they make less than 10% of AMI. They're living on social, I think you heard a little bit about
Yes.
that tonight, right? The average person who's chronically homeless makes less than $1,000 a month, whether that's from disability assistance or that's Social Security. So housing affordability is really a challenge for them. Even affordable housing, a lot of people don't realize this, is targeted to folks who are at 60% AMI. So even to do affordable housing, we have to further subsidize that, either through a voucher or rental assistance. And then, of course, we don't want to forget the supportive services. A big portion of staying stably housed is having access to clinical care, having access to case management, folks who can support program participants in maintaining that housing success, accessing all the community resources that they need, helping them get employed, whatever their life goals are, really working alongside them to do that. So we've seen immense success that we really think the massive investment in permanent supportive housing has been one of the key drivers, as well as a housing first approach. So making sure that all of our services, whether they're shelter or they're permanent housing, are geared around the concept that housing provides stability for everything else. It's really difficult to get clean from substances, to address your mental health if you're living in a tent or you're living on the street. It makes it really hard to get to your medical appointments or to go to work every day. So we look at housing as the foundation for addressing all other life issues, and really are working to make sure that Housing First is implemented statewide. We think that's a big part of our strategy. The other thing I just want to note is we really want to commend the city at this time, where this program in particular, because we're facing kind of unprecedented challenges at the federal level. So just last week, HUD released what's called the annual Continuum of Care NOFO competition. It's the biggest source of federal funding to address homelessness across the country. And for it, what it does this year for the first time is cap how much permanent housing assistance can be provided. So for most communities, they use about 90 to 95% of their assistance on different permanent housing initiatives, whether that be permanent supportive housing, rapid rehousing, some form of rental assistance. Now we're not able to do more than 30%. So what does that mean numbers-wise? For a place like the Lower Shore, it's going to be over $1 million worth of HUD cuts coming in this upcoming calendar year. Those are folks, that's not new money. That's people who are housed right now and people who will face eviction over this next 12 months. So in an environment where we're seeing cuts at the federal level, we're seeing a disinvestment from federal housing practices, from housing first approaches. We're really looking to local governments to help us make the case for continued investment, and not just continued, but scaling up, because we know that right now we're not even serving everybody who really needs that assistance. So we're just here, one, to answer your questions about supportive housing. I am going to turn it over to Kevin Lindemood, who's with me from Healthcare for the Homeless and has been operating supportive housing for forever. I'm not sure how long. I'll let you introduce yourself, but he has been operating supportive housing for a long time in accordance with best practices, and really has seen firsthand how good supportive housing can make not just a difference in the folks who are in the program, but the entire community. It has a community level impact.
Hello, I'm Kevin Lindemood, the CEO of Healthcare for the Homeless and president of a relatively new subsidiary organization called HCH Real Estate Company. Had a wonderful drive over the bridge at sunset. I'm based in Baltimore City and have had the opportunity to work with Danielle Meister. We have at the state level someone who has local experience in homeless services and has just been doing wonderful, wonderful work to increase access to permanent supportive housing for vulnerable populations, and frankly, making sure that Maryland's policies support that work to make homelessness rare and brief. They don't always work in that direction, and we've really got someone on the state level that's working toward that. Healthcare for the Homeless is a 40-year-old healthcare organization providing medical care, mental health services, social services, addiction treatment, outreach. I joined that organization about 33 years ago as an outreach worker. And I was working in a housing readiness environment. So this was an environment where housing was not seen as the solution, where people had to go through transitional housing. People were deemed not eligible for housing unless they had achieved certain milestones. And what I personally found is that some of the most vulnerable ended up staying on the streets where they got sicker and they died earlier than the rest of us. People experiencing homelessness are generally 3 to 4 times more likely to die prematurely if you live in a homeless shelter, up to 10 times more likely to die prematurely if you're living on the streets. What we would do is we would try to help people get housing anyway. Help people obtain disability assistance, move them into housing, and give them the services that they needed to stay there. That housing readiness paradigm began to change in 2005 when then Mayor O'Malley in Baltimore City wanted to close down an encampment at a church. About 30 people were living in it. He wanted to arrest them, and we said, Mr. Mayor, if you arrest them and incarcerate people, when they come out, it's harder for us to serve them. They're not eligible for housing assistance. If you move people to a different corner, what have you done? You've moved people to a different corner. He ended up providing our organization 30 housing vouchers. This was right around the time that the George W. Bush administration was implementing a new federal policy called Housing First. Let's stabilize people in housing, and then from that place of stability, give people intensive wraparound services to get access to treatment and recover long-term, but rooted in housing stability. What we found, 30 people moved into housing. A year later, studied by the University of Maryland, everyone was housed and their health had improved. Since then, we have been rapidly expanding, perhaps not rapidly enough, this housing first approach. Today, Healthcare for the Homeless supports 550 households, 850 people. In permanent supportive housing interventions. As Danielle mentioned, 95% retention rate long-term. There are tools now that I did not have when I was first doing casework to get people into housing far more rapidly. A study by the Hilltop Institute found recently through a supportive housing program that uses Medicaid dollars to finance the services, 5-year study of this program, statistically significant reductions in emergency department visits, hospitalizations, hospital readmissions within 30 days, comparing 1 year before placement in housing and 1 year after placement in housing. With that study, the state of Maryland was convinced that this intervention actually is effective in saving Medicaid resources. Otherwise, you're paying for people cycling back in and out of emergency rooms and having health conditions that have only exacerbated. And so we find that with this intervention, we're not only helping people live longer, helping people improve their health, helping people reintegrate into sustainable communities, but of course we've realized that there's just not enough housing. So about 6 years ago, we began to partnering as a healthcare entity with a local developer. And they built first a 12-unit development that we moved 12 people into. It's been 6 years, and there's been 2 turnovers in that unit. One individual moved an hour away to be closer to his brother with whom he had reconnected, and another person passed away. Everyone else still stably housed, and more people have moved in. Since then, we have become a co-developer. 3 years ago, built a 70-unit development, 35 units for people exiting homelessness, 35 affordable at 50% of area median income. Next month, we will break ground on turning one of our old clinics into 42 units of housing, 28 of them, 2/3 for people exiting homelessness, the rest affordable at 50, 60, and 70% of area median income. And we just received receive tax credits to convert 2 downtown hotels into 117 apartments, including 92 units of permanent supportive housing. So there are ways that healthcare entities, local governments, state governments can collaborate together to actually increase this intervention, despite the federal headwinds and challenges that Danielle Meister mentioned, but to actually improve health and end homelessness at larger scale. We have been so impressed with what you all have done in your community to actually, we don't hear of this often, as Danielle mentioned, in smaller communities, actually investing in housing interventions and showing the extent to which they work long term. As Danielle mentioned, fundamentally, I think we have to ask ourselves, what is the problem we're trying to solve? Right? Healthcare for the homeless, 40 years ago, we thought we were solving a people problem. Healthcare for the homeless. Let's get in there and provide healthcare. Let me tell you, all the healthcare services in the world aren't going to do absolutely anything unless we can root that care in permanent housing. And when we look nationally at where homelessness has increased the most, 3 years ago, 2 years ago, last year, it has increased the most in areas with the highest housing cost and the highest cost of living. Homelessness fundamentally is a housing problem. And if we start with that premise and then bring services to bear from that foundation of housing stability, we have found that we can collectively achieve incredible things for our communities, where people reintegrate into broader communities, are no longer experiencing homelessness, are no longer cycling in and out of jail, in and out of emergency rooms, but are supported stably, long-term, contributing 30% of their income, reconnecting with families and friends, re-entering the workforce if that's something that they're able to do. Housing is the only tool that I have seen as a healthcare provider over the last 40 years that is really capable of both improving health and ending homelessness.
Well, thank you. I mean, I have several questions, but I want to pivot to the council. I'm just like, all these ideas. Yep. This council is so ready to restore, protect, and expand on housing that we're pivoting and we're ready for business. And that's why we've called some experts in, because we need help. This is a heavy lift for a small community, and we're going to need the resources provided. But I do want to, before I get into some of my questions and ask, I want to pivot to the council. Councilwoman Shield.
Currently, we have 34 men that we just brought into a cold weather shelter as of Sunday, and they're there for 5 months. My question to you, my request, well, it's a question. Who at the state level, or even you as well, Mr. Lindemann, would be, who is available to come to Salisbury, review what we have here as far as available, whether it be property, buildings, whatever, and do a real, honest-to-God evaluation of what we need to do. I'm at a loss. I've been working with the homeless through the churches for the last 15, 20 years. We see repeats. I can name the same 20 that were there last year that are back again. Christy, if she's still here with the library, does an amazing amount of work with that. I would like someone to come in instead of spinning wheels and actually tell us what we need to do. I don't know. I mean, I read about it, I hear what you're saying, the percentages, this, and I mean, it's great. I mean, I understand that, but it doesn't fix what we're facing here right now. So I want somebody to come here, and hopefully for free, as a state person, to tell us, evaluate what we have, and go into the county as far as I'm concerned. I mean, bring the county in. I'm sure
Yes.
Nick and the mayor would be happy to do that. We all have connections to the county council. But please, just somebody come and tell us where to go. We may not have the money, but we need a long-range plan. We need where we start. What you were just talking about. You started with 17. Now you're up to, fill in my blanks, 92. and more.
And we'll be at several hundred in a couple of years, yeah.
So, I mean, we have to start somewhere, but we don't know how. I don't know how to do it, and I would like someone to come and help me.
Yeah, I mean, Secretary Dale probably hate me for saying this, but I'll do it. I'm just kidding, but.
No, I met you before, Ken, so I know,
right?
Danielle.
Are you kidding? This is my secret passion. No, I would be genuinely very much happy to come and work with you all around a local response plan. You know, a lot of the times we're working with your local continuum of care lead agency.
Right.
Not so much with local governments,
Yeah.
but I think that is something that we could do is really like look at the needs in your community, even specifically to Wicomico County, you know, because often there's a regional response, but there's also a hyper-local response that we can build. So I'm happy to do that, you know, do some technical assistance with you all. I don't charge, so it is free.
But the COC is doing a great job, but I mean, I
But they have
don't know.
limited access to resources.
That's the thing, and the resources, how much, you know, you have this, you know, wraparound help, that type of thing. But
Yeah.
where do you start? Some of our men are, you know, taking advantage of I mean, Hope downtown in the basement, amazing job of the Presbyterian Church, those of you that aren't familiar with it. I mean, we served 110 people a hot lunch last Thursday, and we're only open 2 days a week.
Yeah.
So anything you can do, please bring it on.
Yeah. Yeah. I mean, we are doing some things at the state level that I think are worth sharing about. So, historically, DHCD and the state have not invested capital dollars into addressing homelessness. And that is something that we've changed this year. So, I'm sure you've heard of low income housing tax credit projects. Primary source of federal funding for affordable housing. This most recent cycle, we put out what's called a qualified application. It's allocation plan. It's essentially an RFP. And we just awarded projects across the state, but for the first time that has a homeless preference. So 15% of any units that we create through that funding source now have to be targeted towards homelessness, and they take those referrals from the local continuum of care. So that is one way, but that's a longer term solution. Those are new units that have to get constructed. So in this meantime, we also have to work on things like tenant-based rental assistance programs, more of what you're doing here, and figuring out how to fund that. There's some things that I can do to help you join the state's Medicaid pilot. Kevin mentioned that a few minutes ago. Communities across the state are using Medicaid to pay for case management and pay for
Okay,
social
that would help.
services. Yeah, and really what's been a limiting factor is until last year that required a local government match to participate. Governor Moore took care of that this last session and allocated state funds. So local governments no longer have to provide a match to be able to participate. So there's things like that we can take advantage of right away, and I can help provide coaching to the local jurisdiction on how to take advantage of that. But it sounds like what you probably need is a strategic response that's rooted in data around what types of housing would be effective. Not everybody needs permanent supportive housing. Some people can get back on their feet with shorter term interventions that are a little bit more cost effective, you know, on a household basis. So there's some planning work we can support you with.
Do you know if there are any, and this is the one thing, do you know of any initiatives regarding mental health as far as cities and counties around the state picking up the cost for dealing with mental health and addiction centers to help people work through that? Is there additional money coming down the pike for that? Because that's really a push, as Councilman Blake said, that's a real push up to fund
Yes, indeed.
in the homeless community.
Right, and you know, health services and resources are so very important. One of the things that we did not talk about are the additional challenges, in addition to the HUD funding challenges that we're navigating on a federal level. We're also navigating challenges to Medicaid, right? And I think we all know that in 2027, there will be implemented new work requirements, address verifications, and more frequent reapplications that we believe will complicate access to care for the most vulnerable, particularly those with complicated medical problems, mental health challenges, and addiction challenges. We're working to try to ensure, and when I say we, all of the community health centers in Maryland, to try to ensure that we're better able to help people enroll and help people maintain that coverage. The state right now is determining, as all states are, how it will implement those new requirements. There are a series of exemptions in the law, and it's unclear how those exemptions will be implemented, but we're working with the state to try, especially for people with behavioral health challenges, mental illness and addiction and medical problems, how can we make sure that to the extent possible we're exempting people with disabilities and helping ensure that they retain coverage and gain coverage. Then, of course, even with something like Medicaid coverage, of course, getting people access. I do not know what community health center coverage you have specifically. I know there are community health centers operating in the area and serving a range of populations, but working to build relationships between health center providers and homeless service providers to try to overcome some of those barriers, because community health centers are to meet the needs of all members of communities, including those experiencing homelessness. The co-location of services can help. Co-located healthcare services in shelters, in supportive housing programs can absolutely help. So I think there are many ways to try to ensure that you're weaving together those service and healthcare approaches. We've been finding in conversations with our hospital partners as well, there's so much more alliance these days between health and housing, and healthcare providers understanding the importance of investing in residential stability because it improves the health of their patients and lowers costs for everybody.
Yeah, one of the things, I'm sorry, go ahead.
My question is, how do we help criminals, felons? These are mandated state laws that they cannot, it's hard for them to get housing.
Yeah.
So how do we help them?
Yeah.
Because if they fill out an application and they say they're a felon,
Bottom of the list.
they're blackballed. My daughter went out yesterday feeding the homeless behind Salisbury Middle. She saw a young man her age. She says, Mom, it just blew me away. She said, I couldn't do nothing but cry because he said, I can't get a place because I have a felon. And it seems as though the government has a stronghold on homelessness. They say they want to help, but how do you help when you're hindering the most vulnerable population? I don't understand, because you have mental illness, people don't want to rent to them. Because you're a felon or a criminal, they don't want to let you have their place. If you are, you don't make enough money. Because that seems to be the problem today. Either you don't make enough or you make too much. So we're in the crossfire. How do we help these people? Because this is where people are becoming homeless. I know a family that went to get housing. And it was a mother with kids, and they told her she didn't make enough money. So there she is out with her kids with nowhere to go. And that's a problem. And like I said, with the felons who come out of prison, you know what? Everybody goes to jail and get a felony is not a felon, okay? A lot of people go to prison on account of being misrepresented and other things, and because they just want somebody locked up. And I am tired of hearing our young men cry because they cannot get a house, can't get a job. If they can't get a job, they can't get a house. So how are they supposed to survive? And a lot of these young men out here now that are homeless are felons, are criminals. They just don't have mental illness. They have criminal backgrounds. So, I mean, how do we help them? I mean, they need help. They really need our help. And the government, state government, federal government has made this law, and it needs to be changed. Men cannot, even if they got a felony, they can't even go in their home and live with their children because they have a felony. People do change. People's lives do change. And you cannot it's not fair to hold that over a person's head. You know, some men do want to be fathers to their children. But they can't. If there's a subsidized apartment complex or whatever, they can't go in there and stay. And if they find that they're in there staying, the young lady's gonna be out with her children. She's gonna be out. All of them gonna be out. So we've got to find a way to work with this as well. This is a big problem here, not only here, but in other states as well. So we need to find it. Then again, we have houses, abandoned and blight houses that we can use to house people. I mean, I've seen so many places, and I've been fighting this fight ever since I've been on the city council. I've been on here 10 years, and every time I turn around, I was always told, we don't get into that. We don't get into purchasing homes for house. Well, you just purchased those tiny homes. So why wouldn't you go and get a house that could accommodate at least 5 people, and they pay? The city, it will be revenue for the city and revenue for them because you make them save a certain amount and you make them pay for their bills. So you can't tell me that we're not coming across with them having money and the city making money. No, I don't want to make money off of homeless, but I do want to see the homeless people provided and put in safe, healthy, and as you said, most people that are homeless are sick, and they become even sicker. Just had a young lady call me Sunday, she didn't call me, hit me in Facebook. Young man on a bench, sleep with colorectal cancer. She provided him a 2-night stay in a hotel, and another pastor came forward with another night. How do we, how do we conquer this? You're pros at it, so tell me how.
Yeah, I mean, well, I just want to commend you, one, for bringing up the issue of when folks come out of incarceration, finding housing is really, really difficult. Incarceration is not just a cause of homelessness, it is an effect of it, right? People who are unsheltered tend to be over-criminalized by arrests, law enforcement. There's a very strong cycle between incarceration and jails and homelessness. So some of the things that could happen, I mean, some of these are policy issues, right? So there is a lot of discretion under law for landlords to decide who they rent to. So from a policy perspective, some of the things that could happen are the state taking up legislation to create better renter rights around that and what can be screened out and what has to be screened in. How do you consider a background? HUD has actually, in prior administrations, did some of this work to lower barriers for the voucher program, for example, which has its own boundaries. We've done work at DHCD on our affordable housing portfolio to lower criminal background restrictions to make it more accessible to folks. But it is a challenge. A good portion of folks that we serve in the homeless system are dealing with some kind of criminal record. Even, I would say, a misdemeanor can cause people not to get housing. It doesn't have to be a felony. It's sometimes as small as a misdemeanor. And one thing, like I said, landlords have a ton of discretion under the law to decide who they rent to. From a programmatic perspective, what can be done? There's a lot of communities who are doing things like master leasing so that the lease is in the name of the nonprofit or the organization, not necessarily that individual person, and they're subleasing to the person who has a criminal background. So in the case where a landlord doesn't want to take on the risk, so to speak, although I would argue that tenants with criminal backgrounds are not substantially worse tenants than everyone else, right? Just because you have a criminal background does not make you a bad tenant or incapable of following a lease. But there are programs around the state, around the country, where a nonprofit or a local government steps in and they lease a building and they sublease units or they sublease rooms to folks who are, have those kinds of backgrounds. So those are the kinds of strategy, to your point earlier, like what can we do? Those are some of the strategies that are out there. I do think there's policy solutions that have to address some of those underlying issues. We still have challenges for folks getting employment, things like that. But yeah, it's a major challenge. I don't have the data in front of me, but it's somewhere close to 30 to 40% of folks have some form of criminal background if they experience homelessness.
Daniel.
Send us that data? Could you send that data to us?
Yeah, we can send that. Yeah, Baltimore City actually did a study. They did a data match between the criminal justice system and the homeless system. And so we don't have the data for everywhere, but I can show you what Baltimore did. And vast majority of the cases were actually expungible but for whatever reason, they weren't off their record, and that was preventing them from getting housing. So there's
even
things
know
like
how
that
to
we
do
can
it.
do, right? Like, there's services that we can coordinate better, we can deliver better to help people remove those barriers. They're not always permanent barriers.
I would just add that the city of Denver did a social impact bond program where they leveraged bonds to build housing and do scattered site housing. It was a combination of several hundred scattered site units and a 100 unit low-income housing tax credit development specifically for people leaving jail and prison. And what they found are outcomes very similar to what we're seeing across permanent supportive housing programs. They found decreased recidivism, increased employment, long-term retention in housing. That program is actually still being studied, but I'm happy to share with you the initial study that was released of that initiative. You might think, okay, this is a really big program in a really big city. Baltimore's Behavioral Health Authority just released last week a request for proposals for a 25-unit permanent supportive housing program for people leaving jails and prisons. And so they're looking for people to do it scattered site or site-based. They're looking for people to respond. So you don't have to start as large as a big social impact bond program, but can start with something much more, much smaller and targeted toward people with mental illness who have criminal records.
Danielle.
Hold on just 1 minute, Mayor Taylor. It's council comments, and then we can pivot to you. Councilwoman Gregory, did you have any comments before we
Actually,
wrap this
Sharon
up?
kind of asked what I was going to ask about, but I really want to emphasize any data points that you guys have that you can send us. Please send us everything. I would love to comb through it and take a look and see if we can find stuff in there that will lead us to make better decisions as far as getting this problem tackled, because it is a huge problem. I'm someone that, someone asked earlier if anybody of us on the council had experienced homelessness. I have, and it was because my father had mental health issues, and he was chronically homeless through his entire adult life, off and on. And I've seen what that can do when you don't have the supports, not getting the treatments you need. That alone, I think that's why I'm so passionate about this. I really want to make sure that we have the right data and we've got the right idea of that data will give us a roadmap as to where to go. So if you can send us whatever you guys have, I would greatly appreciate it. If you think it's too much, keep sending it.
Oh, no, this is stuff we have on deck ready to go. I mean, there's a huge evidence base around how to solve homelessness.
That's what I want,
And
evidence
that's what I
base.
wanna hear.
I just want to reinforce, homelessness is the downstream effect of a lot of other
Yeah.
challenges. Lack of affordable housing, a lack of inpatient mental health and substance use care. If today you wanted to get someone who is experiencing a mental health episode or substance use into treatment, they might have to go on a waiting list, right? And so part of our delivery of system of services, we need more capacity in all of these other places, which will help relieve the burden. And then there's ways to coordinate better and deliver services better. So it's a multi-pronged approach to solve homelessness, but there are communities who are making significant reductions by investing mostly in housing. That's the number one thing that really helps to bring down homelessness is how there's a direct correlation between how much do you invest in housing and affordable housing for folks.
Plus, your other issue here with some of the grants, if you're a low barrier shelter, no questions asked. And then if you have private shelters, they can create their own conditions. So when you set up conditions, you have issues that can exacerbate the people that are able, that are left out, quite frankly. I would just like to piggyback, and then I'll stop. I'm sorry. I would like to figure out a time that works for either or both of you to actually come here and give us something that we can start with and recommendations that you would have.
I was going to have Ms. English take down all the contacts and contact them tomorrow to schedule. So we can do that and put it on a work agenda. Before we wrap up, Mayor Taylor, did you have some comments?
Yeah, I was just going to say, our Housing First program is about 10 years old, and as I looked at it, we spent about $1 million to do about 11 households, and with deaths and people leaving, and for whatever reason, we helped about
40 people?
16, 18 people. So what I was trying to do was say, could we get people to move on to a permanent housing voucher or some description, and then we can recycle that money. And we've actually seen that happen. We had a few people freed up, and I think are going to be able to recycle, maybe do more. That all said, I had a meeting last week with Hope, with Debbie Rossi and Christine, who runs our homeless program here at Ann Street. And the composition of our homeless problem is really unknown. I mean, we have data points, mental health, addiction, elderly that just, financial just don't have any money to support it. Mm-hmm. There's a whole bunch of reasons why people, and no one's arguing that, people that are housed are much less likely to show up at ER, police visits, the whole 9 yards. That's not the argument. It's the question of how do we right-size our funding? $100,000, grand scheme of the budget, nothing. No one said we were cutting anything. We were maybe tripling it. We may be doubling it. We're not talking. We're talking about trying to fix the problem. We serve about 17 people at Ann Street. We've got about 11 people or 12 people in our housing first breed. That's 31 people total out of 300 homeless, out of 22,000 residents who rent in this city. It's infinitesimal. Can we do more? Can we do better? Can we close more gaps? I think we can. We need to understand the complexity and the makeup of our homeless population, and then right-size both funding. For $50,000, we can bond $500,000, depending upon rate, to build a facility to do the short-term, long-term, mid-term, rapid housing. I'm not afraid of that. I'm not afraid of that as a leader. As a leader, it's just that we need to find out what the source of the problem is, and we need to think more creatively, not just check a box that, hey, we've got this program and we're ahead of our peers in cities our size. That's not what we're about. So that's where we're coming from.
Yeah, so I think to get, that's a big statement, and that question of how do you effectively deploy a PSH program, right? That takes a lot of careful evaluation of an existing program and the clinical needs of folks who are involved. One thing I caution folks about is with permanent supportive housing, if you're doing everything right on the front end at the intake process where you're prioritizing the folks in your community who have the most severe needs, you should be thinking of permanent supportive housing as a lifetime intervention, because it means you've on the front end, you've put the folks in there who are retired or maybe have really severe disabilities, chronic diseases that mean they can't go back to work. And so without that subsidy, without those supportive services, they're not going to be able to remain stably housed. Now, there are communities that successfully use what we call move-on strategies. So that would be folks who come into a PSH program, they stabilize. Some people over time are able to start working, and it makes sense for them to go into something like a voucher. I think the cautionary tale is that for a lot of move-on strategies, because those vouchers don't come with services, folks often come back into the homeless system. Right. It's really, the housing is important, but the services are just as important, right?
I'm often asked which is most important in a permanent supportive housing setting, the housing or the services, and my answer is always yes.
Yeah, but it's a both-and approach is what I would say when it comes to housing investment. You have a range of people in your community who have varying levels of need, right? There's some people who need a lot of help. There's some people who need just a little bit of help. Yeah. The key is to have a wide range of housing resources that can be matched strategically to folks' level of need.
And right now we don't have that. And if we're going to play in that space, we don't have control over our partners and what they do and how they do it. But I think we're going to play in that space. I think we need to understand it first, and then we fund accordingly with some knowledge and front-end information.
Right. I often say that we can't end homelessness by ending homelessness, which is a little bit of a head-scratcher. But what we've done is, as a country, we've prioritized housing for the poorest and the sickest. Yeah. And when we do that, okay, that's wonderful, and we've had these great outcomes. But if we're not addressing broader affordability, our firefighters, our social workers, our people earning middle incomes that aren't able to keep up with the rising cost of housing remain at great risk of homelessness, right? So we can't end homelessness by ending homelessness of those that are experiencing it. We have to figure out how our broader public policies address housing affordability, access to health care, incomes that are livable, and not just minimum. Yeah. And I think if we adopt both of those approaches, I actually think some of the best things communities can do to address homelessness are policies that benefit everyone within communities, right?
Well, I cannot thank you, our council cannot thank you enough for coming here, spending this time, talking about this issue in this space, and giving us a lot of guidance. I know our city clerk, Ms. English, will be reaching out, and we'll have a lot more coordinating coming our way, and I'm really looking forward to tackling this and getting some results and resolved to some of these concerns and issues in our community. Just thank you so much.
And we're
Very
happy to
appreciative.
be of help. I mean, the TA you're talking about, the support is exactly what our team can offer. So I just want to, really let you know that we're your partners in designing, a better response system and figuring out how we can deploy resources effectively.
Thank you.
Thank you so
Good,
much.
thank you.
Thank you, guys.
Thank you.
For making the trip.
Yeah.
Thank you very much. That was wonderful. I think that gives us a
Safe
nice,
going home.
a nice starting point and pivots us in the direction that this council would like to move. Thank you so much. Okay, back to the work agenda. Resolution, the North Prong Park project. Project engineer Travis Huff.
Travis.
He's going to share with us this wonderful expansion going on.
All right, Travis.
Good evening. Good evening, Mr. Huff. How are you?
I'm good. How are you?
Oh, good, good. Thank you for being patient.
Of course.
Okay. Would you like to go ahead and start for us, please?
Sure. We're here to request the city to accept $500,000 that has been earmarked to us.
We agree. Thank you.
Excellent, excellent.
Come here with a check.
With a check,
Outreach.
thank you.
It is from the Department of Natural Resources.
Yes.
Their local parks and playground infrastructure grants program. It is going towards the remediation of the industrial sites it's on Lake Street as part of our North Prong Park
Wonderful.
project.
Fantastic.
Yes. Long overdue.
Well-deserved.
Thank you, Mayor.
Doing what we can over here.
Wonderful.
Overdue.
That was easy. Push the easy button.
All right. Yeah, I mean, any questions or?
I'm just ready for it to happen.
No, the packet
Same.
was well put together. I know, we've been talking about this for so long, and we're so excited, and I know that Councilwoman Jackson is very excited and well-deserved, and we're looking forward to the results.
And if anyone doesn't know where North Prong is, it's on Lake Street.
I have a suggestion. Travis, would you either say right now or make it available the information that you shared that night, the update on the project, where people can go on the city website to get that? Will you share with us where they can go, because it's full of information because of you?
Sure. On our city website, if you go under the Department of Infrastructure and Development, under sustainability, there's a section in there called brownfields. That is what this area has been deemed because of contamination from an oil spill. In there, you'll find all the information that I have put in there with our remediation of 317 and 325 Lake Street. What we are doing there, we are going to remove 2 feet of soil and replace it with clean soil and a soil cap to prevent any of the soil migration coming back. That will make the site recreational safe, so that way we can put a playground on that property.
Let me ask you another question. Now, you said an oil spill. Now, I need to know, was it a significant amount of oil? I mean, I need to know, because what I heard when I first brought this up was it was some leakage, some spillage, but no.
No,
It couldn't have been true. I knew it was.
it was a pretty significant amount. I don't have it with me, but I
You
want
don't
to say
have
it was
to,
like
'cause you don't have to-
40,000 gallons.
Yeah, you don't have to, because I knew it was not true at all.
Yeah, it spilled on the soil and it went into the
To the
river.
Yes, it did.
That has been deemed safe by the Army Corps of Engineers. They went out and they had monitoring wells put in and the bulkhead put into.
It's deemed safe now, but how about the years it was there and the spillage was going on? And my problem is, a lot of people in that community died of cancer. A lot of them. My parents were 2 of them that died from cancer. We lived in that area. And it is sad because that should have been, and I'm not blaming nobody here, but it should have been taken care of years and years ago. And it was left there. And when I asked the former mayor about having that done, it was just like tiddlywinks to him. It went through his fingers. But I'm very adamant about that because I have so many people that lived in that community. I've had my mother and several other family members who have died, friends who have died, and it was from cancer. And they lived in that predominant area. So I know that now it's clear, but it wasn't always clear.
All right, yep.
Okay,
Say
thank
it.
you.
Thank you so much for sharing that, and also sharing where they could find that on the website. We appreciate it and looking forward to the outcome so much. Thank you so much.
Thank you.
Thank you.
Thank you so much. We're going to move on to resolution, talking about the annexation for zoning for North Park Drive. We have Associate Planner Zach White doing a presentation.
Good evening.
Madam President, just for clarification, did we get consensus to move that item forward to legislative session?
You know, I'm glad you reminded me. Thank you. I'm not sure. Let's go back to consensus. Do we have a consensus? Do we have a consensus to move this forward? Yes.
Yes.
Yes, we do.
Thank you.
Thank you, Ms. English, for keeping me situated. Okay. Resolution, moving on to annexation of zoning for North Shoemaker Drive.
Okay. So you guys should be somewhat familiar with this. We've presented in front of you a couple times. We've also invited the petitioner to be a part of the presentation.
Thank you. Thank you.
So Camden Development LLC is requesting the annexation of a 12.465 acre parcel on North Shoemaker Drive into the city of Salisbury, along with an adjacent roadway and portion of waterway for a total of 12.870 acres. A conceptual site plan proposes 60 townhome units, with the petitioner requesting R8A zoning classification. Below is a history of this application to date, as it is on my page. On June 16th, we introduced this at a council work session, and then on August 21st, we went to the Salisbury-Wycomico Planning Commission for a zoning recommendation. At the present time, the parcel is in the county with R20 residential zoning. The requested zoning by the petitioner was R8A. Staff recommended R10S, and then the Planning Commission recommended R10A. At the September 22nd work session in front of City Council, we requested a zoning decision to be made before scheduling the public hearing, where it was tabled so it could be rescheduled with additional time for questions to both DID and the developer. We bring this forth to you again for direction regarding which zone to assign to the site upon annexation. It is the staff assessment that the requested zone by the applicant and the recommended zone by the Planning Commission are inconsistent with the city's 2010 comprehensive plan. The annexation area is designated for low-density development in our growth area. This means it is limited to 4 to 5 units per acre. Residential A zones in the city zoning code allow townhouses and apartments at a density of 8 to 10 units per acre, inconsistent with the low-density development designation. Planning Commission ultimately recommended R10A zoning, which slightly decreases the allowed density compared to R10A, but allows significantly denser development at 6 to 8 units per acre than supported by the comprehensive plan. The R10A district allows approximately 74 townhome units. The reasoning for the recommendation of residential A zone was that it allows for a variety of housing types, and this is supported by the comprehensive plan because it states that low-density residential are proposed to include, quote, include a variety or mix of housing styles. Generally, in the comprehensive plan, housing types would refer to categories like single-family dwellings, townhouses, apartments, while styles are categories such as bungalow, farmhouse, or rancher, etc. Staff recommendation of R10S zoning is consistent with the comprehensive plan, as R10S prohibits townhome and apartment development. In the case of this site, the developer could build roughly 54 single-family homes, only 6 less than the developer suggested it was seeking to build. Since selecting the future zoning involves an interpretation of the adopted comprehensive plan and will impact this and future annexations, staff requests council direction regarding which zoning to assign the parcel before staff moves forward with having an annexation resolution drafted. This will ensure a smooth process for the annexation going forward and limit legal fees that would ensue if the agreement needed to be redrafted multiple times due to concerns with zoning. And the attachments include a narrative, a concept development plan, a boundary survey, the annexation plat, the petition, and a couple aerial satellite images, which include the zoning, the growth area, a letter from the petitioner, and a letter written, a decision letter from the Planning Commission.
Council, have any questions? I'd like, oh, go ahead.
I do. I'm going back to my original question when we met, when you presented this last time, Zach. We have yet to address a code in our code to address annexation and guidelines from the city, what the city's requesting when we start working with developers. I will not approve of any annexation until this is taken care of.
I would like to hear from the developers, please.
My name's Brian Lloyd. Thank you all for your time. And, I think a couple things, just where we've been and how we got here. We came before this council, as you're supposed to for an annexation, and we showed you the subdivision plat that we were submitted, and you guys told us to go forward. We haven't changed anything since then. It's still the same subdivision plat that we recommended then. We went through the process like we're supposed to for annexations. We went to the Planning Commission. Planning Commission made a recommendation. That recommendation is generally brought to the City Council, and of course, it's a recommendation, so you decide what you want to do from there. No one's disputing that. It's just a little confusing to me that, the council was fine with this, what we submitted, and us going forward, and now having some concerns about some things. And I totally agree with what Mr. Shields saying, but, that's a policy that needs to be done before any more annexations.
I agree. That's my argument.
No. But we're already in the process. We've been in this for 6 months with you now.
Gotcha.
And
So wait a minute.
so
One person speak at a time, please. Thank you.
So, generally, that's just, I think what you're saying is absolutely right. And, but it's kind of tough to pull that, as we're halfway through the process here, I'm sure you can appreciate that as a developer. We've done everything the city has asked us to, has told us to do, and the expense that goes along with that. As I've said before, I'm a local resident. I've been born and raised here. We've done many projects in this community, great projects that a lot of people call home today. I'm like developers that developed Granby Cove and Stonegate and Spring Chase and Tide Mill and the Glade and all those things. And so, our heart was to create a project that's good, that families can live in and can afford. One of the concerns has been about having more affordable housing. That's why we wanted to do the townhomes. This isn't, and I think, and I understand it because I know I'm a developer and I know why developers do the things we do, right? It's okay to be in business. It's okay to be profitable. Those are okay things, right? But this isn't a scenario where I want to do townhomes because I'm getting 35 more townhomes. The net difference is 6. Honestly, if the council wants single families there, I'll build single families. Okay, that's not, I don't have any heartburn over that. I think it's the wrong decision for what our community needs because single-family homes are more expensive. And so, again, I don't mind doing the single families. I can do the single families if that's what the council wants to do because at the end of the day, I want to get the project started, you know. But that was my motive. You know, we have projects all throughout Salisbury. So, you know, I'm building townhomes in Fruitland. I'm building townhomes in other neighborhoods, and I'm building single family. So we want to be a diverse company that has a product for everyone, you know. But that was my motivation. Hey, you know, what does Salisbury need? You know, and I know not everybody's going to believe that because us developers have somewhat of a bad reputation. But, you know, I don't, and I haven't for 35 years in this town. And so that was my heart behind it. And I just wanted to just make sure you guys understood that. If you want to do singles, we'll do singles. They're not going to be $600,000 singles, so they'll be relatively affordable. They're going to be in the high 300s, you know, because you can't build anything
No, you can't.
lower than that now. So, you know, I think a couple other points too, just to consider as well. I think that I think we're starting to split hairs a little bit about styles. I think this meets the comprehensive plan. I think maybe even city's attorney would say that. I mean, when we start getting into, well, what does the word style mean? I mean, we're really, you know, getting in there deep now at this point, you know. 900 foot from this is R8A zoning in 3 subdivisions. 900 foot. Stonegate's 900 foot away. We don't want R8A. We don't want to build 6 to 8 units per acre either. We want to build 4.3?
481.
4.81?
Yep.
Yeah, 4.81. So, you know, so I just kind of wanted to just kind of circle back around on those things, just to make sure that, you know, there's clarity, that there's, you know, understanding of what our intent was. And, you know, I think there's this idea that, you know, developers just make tons of money or not. And listen, I wish that was the case all the time. I'm doing a subdivision in Fruitland right now that I lost 43 units because of non-tidal wetlands. So these are the risks that we take as developers. This isn't, I wish it was. Let me talk to Randy and us about 08, you know, what happened in 2008. Okay, this isn't a glory story all the time. So, you know, I think we have to, you know, not think that. Because that just isn't always the case. But again, it's okay to make money too, I think. But our goal is really, at this point as a company, we like to create communities that people love. That's our motto. And that's what we want to do here. So I don't know.
I'm not attacking you
But I
personally.
just wanted to give you clarity.
Yeah, I'm not attacking you
But
personally.
No,
I'm
take it
thinking,
that way.
I'm
No.
thinking that if he's already gone through the process,
Yeah.
it's no need of stopping it. But what we need to do, like he just said, is tweak the next one. We need to go through and get an ordinance or whatever and start making some changes on how people come in here, because we can't discourage development from Salisbury. We can't do that.
Yeah.
But we can discourage them from coming in here thinking they can do what they want. So you've already got your plan. You've already know what you're going to do. I agree with letting you go ahead and build. Go ahead and build it. That's my spin on it. But the next person that comes in here and wants to annex, we need to know what they're going to build.
Well, and generally, when somebody petitions to annex, they have like a site plan, that at least the concept of what they're going to build. And then we kind of look to you guys to, I guess, make the final decision on zoning. Because I think generally in the past, there was always, like, DID staff and planning commission kind of always agreed on the zoning, so there was never really a conversation. But in this instance, there was a little bit of contention because there was multiple different zones, and that's kind of what we're trying to get out of you guys.
Councilwoman Gregory, you have any questions, comments?
I'm sorry, I just want to go back to something you mentioned. You said that Stonegate has, what zoning?
R8A, the highest density.
The highest density, okay.
Yeah.
And you guys are, the planning commission ultimately recommended the R10A, which
10A.
is slightly.
Which still
less.
goes with the same plan we originally
Right,
submitted to
it still
you.
goes with the same plan. Okay, great. I don't see why we can't do that, because, I mean, it's already gone through, it went through the planning commission, it's gone through all the proper channels, it came through us already. Like, hey, I've lived in a townhouse. We need housing. We need more housing. We need folks to build that housing. I do not see why we would want to bump it down to single-family homes, because I'm sorry, I don't know a single person who can afford $300,000 for a house right now. I don't. That is a lot of money. And if we're building single-family homes, like you said, it's no skin off your nose to build single-family homes, but for the families that are in need of housing, a townhome is a lot more affordable than a single-family home. It just is. And that's why they're so popular, because families can start out in something like that and then graduate up to a single-family home, just like my own family did. I don't see, like April says, if we wanted to have the conversation, and I'm not sure about if we can legally ask them to require that the affordable housing at the annexation level, but that's a question for the attorneys. I don't know, but I don't see why we cannot move this forward as it was recommended by the Planning Commission to create that. It's not even at they're not even talking. You said it was 4.8. So that's not even at the denser allotment. That, I mean, I don't see why we're having to have this conversation. Like, why don't we just go with what the Planning Commission recommended at the time?
Well, I appreciate your statements, and I think, again, just, you said it, but just for clarity point, we're only asking what the Planning Commission recommended. We're not asking for any more than that, so.
It's fine.
I think also, to the point of the conversation here was a little bit that we didn't want to, and I have no reason to think that the petitioner is going to build anything outside of what they have presented to us, but the idea is that they could build something at a density higher. That's really it, but it's ultimately your guys' decision if you want to move forward with it.
That's my concern.
Well, I mean,
We need to start paying more attention to the annexations.
well,
And
Well,
sorry.
I'm just, if I
One
may,
at a time.
I mean, you don't go through the process of paying for all these plans, because I don't even want to know how much it costs to get to this point. But I just, if, the healthy level of mistrust, I understand, I get. But I think that even if they were to develop more, they still have a lot of wiggle room, because it's saying here that it allows for 6 to 8 units. So they could almost double the number of units and still be within it. And that's still not terrible. I mean, that's just more housing for our residents that are desperately crying out for housing. I just don't understand why this is a problem. So,
I guess the only thing is it kind of goes against what was written in our comprehensive plan,
Well,
albeit the comprehensive
to
plan is
speak to that-
2010.
that's a whole other
but-
issue. That's
Yeah.
a whole other issue. And
I wanna
again,
speak
this
to
is-
that, yeah.
Because, I mean, that plan is from 15 years ago, in a very different environment as far as housing is concerned, in a very different climate as far as the economy is concerned. And I think, I would love to know when the new comprehensive plan is going to be put together and finished, because that is something that needs to get done yesterday. But, I say we just move forward with the planning commission.
Yeah, I say if we're gonna address the code, we need to address the code, but there's a couple other things internally I think we need to address as a city. First of all, you did cite, since you cited it in here, that it's consistent with the 2010 comprehensive plan. It's very outdated, but one of the things about the comprehensive plan that's interesting is that we, about 18 months ago, there was breakout sessions throughout the community where people were to build the comprehensive plan, and we were to be writing the comprehensive plan, and council members have been constantly asking for updates about the council plan. So the council plan is about 4 years outdated, and we definitely need to, obviously, for this purpose, get it dated. However, one thing that is noted is that in the comprehensive plan, in 2024, during a survey, the city started the process of updating its comprehensive plan. In the survey, the most popular answer was to increase housing opportunities for low-income, moderate-income, and fixed-income people. The requested zoning and use of townhomes would allow this to meet those goals. So using a measurement, if you were using the measurement to bring this forward to the council, it would be interesting for me to understand how Johnson's Retreat got through the 2010 comprehensive plan, using this measurement that you're using here, or how Glen Avenue, Glen Heights got through this measurement, and so on and so on. And the other thing, in regards to the annexation, I do appreciate, Nick, you put a nice presentation together about the annexation, and I appreciate that. One thing that I did note, and this goes back to what I believe Councilwoman Jackson said about fixing the code / and us paying attention more, is you left out number 11 and 12, which directly talks about the very process that these developers went through to get to the stage we're at now. So we have long passed the start point. We're at the finish point. We're at the shovels in the ground point. And it's not reasonable or prudent for the city to go back on its word. And we've been through this with other developments and other projects. And we need the housing. We need units. The number one researched solution is restock. We need stock. So blocking this would block that. And it doesn't make sense on the measurements that you're using. In the future, if we want to do something, that's fine. But I'm definitely ready to make a consensus to move this forward. Do we have consensus?
Yes.
Okay, we have 3 to 4. It moves forward?
Consensus for
Moving the project forward?
So I believe the question was which,
Do we need to move forward with the
The
specific
townhomes
zoning
or
in
the
order for us to write the
I say,
ordinance to move forward?
I say go forward. Excuse me, some people were,
townhome.
What are we moving forward?
I think, I would like to know if you would be interested in moving forward with, I guess, the original,
If I heard you all correctly, it was move forward with what the planning commission recommended.
yes.
And again, we have a new planning commission now with the city, so a lot of these questions that you guys are asking, we can
Yes.
definitely button up with the new planning commission. But from what I heard, it was
Yeah, I
move
think that's
forward.
what,
Okay, then,
Ms. Gregory had said.
I'm in agreement with that. Mr. Lloyd, one of my concerns was the density issue. When you have single-family homes that are already established there at the perimeter of this new development, how they are feeling about the type of congestion that's going to be moving in there, which also translates to density. But as far as what you've all said, this is putting the horses already out of the barn. So moving forward, though, I think it's absolutely paramount that we come up with something in our code that addresses annexation in the future. So,
Yeah, I was going to say, I've intentionally stayed out of this because this is a council decision. But to your point, I think this, close to the early spring, we need to be finishing up our comp plan, looking at our zoning code. I think council actually can speak to the issue. We've got a fairly good SOP on annexation right now in terms of process. But to your point, I think this is the first time the city's ever had to deal with this idea of incorporating affordable housing as a development concept as an existing, because the market usually just delivers it. And we're not seeing that. Of course, land costs are higher. So we're having to, like more urban areas are having to deal with it more for the first time. So that said, well intended, I think it's a good idea on how we're going to implement it. It's going to be a little bit of a complex journey, so we got to figure that out, but I don't think we should wait. And I think it's a good decision to move it forward. Thank you.
okay.
I'd also just ask one wrinkle that the council might consider as we end up crafting the annexation plan and agreement that is what you guys end up adopting. Sometimes those can have sort of restrictive covenants whereby the developer has to build largely what's been presented. That can kind of mitigate that issue where, hey, the city's worried that they might build at a higher density under some strange circumstance. I'd want to know if the council would want to consider the city moving in that direction to include language in the annexation agreement to sort of hold the property owner, the developer, to the project as presented.
Or if they sold it.
No,
Yeah.
I just,
Yeah.
I don't like that either.
I'm sorry, would you like to speak on that? I just think,
the city administrator spoke last meeting and said that they were not able to do that.
right.
Here, in concept, I have no issues with that because this is what I plan on building. I think what I would say, for what it's worth, my 2 cents, I think the city needs to be careful of making contingencies upon zoning recommendations that they approve. I think that's a slippery slope. That I think when do you not, you know, and it's this department's decision to decide when you recommend when you do and don't. I think, you know, for what it's worth, I think that the process that someone set up for this town works. And I think it's the process. And I think the process is the process for a reason, because there's people that make decisions that's not me. And a planning commission that makes a decision, you know, not recklessly, what they think, you know. And so I'm open to the conversation, but I think it brings other things with it that, you know, will outlive me, that maybe is not best for the city. And I think you just have to be careful about, you know, I still think there's this principle that you have land, and if you have a zoning, you're able to build on it, you know, and, you know, again, right now, I can't put anything more on there between the stormwater pond and the streets. I mean, here's the thing, just look, here, all this stuff a little bit is speculative. There's new MDE regs coming out in '26. I may lose 10 units. We none of us know that. You know, and as you're thinking about, and listen, I want you to know, I will 100% be a developer who would like to be at the table when you all are talking about affordable housing and how developers can help the community. Love to be part of that meeting, for sure. But, you know, a lot of this is speculative. That's why they call it spec homes, you know, because you don't really know until you get into it. And I think that, you know, you have to think through some of these things and how we accomplish the goals. We're at a point in our business where we want to be part of that with the city, you know. So I would prefer not to do that, just for the reasons I stated.
I could just say quickly, it's not an idea I came up with on my own. It exists in a number of annexation agreements that already have been processed through the city.
So we're looking at the consensus with the Planning Commission ultimately recommending the R10A, or, okay.
Well, that's it.
Consensus.
We have the consensus?
Yes.
To move it forward, yes. Thank you very much for the discussion.
Thank you.
Okay. We have our ordinance amending Chapter 2.25 of the Salisbury City Code entitled Labor Code to better define material terms, clarify employment rights, redefine the duration of the collective bargaining agreement and timeline for bargaining, and to amend the terms of governing arbitration. Human Resource Director, oh, excuse me, Meg Caton right here, and we're ready.
Okay, good evening, Council.
Good evening.
Before you is an ordinance proposing amendments to Chapter 2.25 of the Labor Code. These updates are intended to modernize the city's labor provisions, clarify the collective bargaining process, and better align the ordinance with current operational needs. The proposal focuses on 2 key challenges: adjusting the bargaining timeline and removing binding wage arbitration. And all changes are shown in bold and underlined in your packet. And then we also should hopefully have Dan on Zoom. Yes, there he is. Can you hear us, Dan? Ooh, we can't hear you.
It's usually where Chris comes to my rescue.
Chris,
Ta-da!
It's a bad signal. Can you hear me now?
He can hear us, but we can't hear.
You remember when you had to do the entire meeting on Zoom?
Okay.
Can you hear me? Hello?
No.
Hear him, it's just faint.
Oh, see, I can't really even hear him.
Yeah.
Can you hear me? Hello? You said hello, hello?
Sorry.
We can hear you, just not very loud.
Chris! All right, I'm sure what the problem is here.
That's what I was trying to say. I don't have my glasses today. Yeah, what's up?
How's that?
Oh,
There we go.
Loud and clear.
Thank you.
My apologies.
Okay.
Yeah.
Yep. You can go ahead, Dan.
Oh, okay, I wasn't sure. So, yeah, I'm sorry. Apologies for not being there in person. I had a late meeting this evening as well, and for the technical issues. As Meg said, the changes to the code were based on having a couple of years of experience now engaging in the bargaining process under the code, addressing some of the issues that emerged, and practical issues that emerged, and really, in my view, bringing making some changes that bring the code into the sort of mainstream of bargaining ordinances and bargaining laws in municipalities around the state of Maryland that do have bargaining rights for public employees. So I'm happy to answer any questions that come up, but a couple that I can just sort of give a quick overview, and I know the council has looked at this previously, but some of the changes are really technical in terms of just shifting the timeline for collective bargaining to better align with the budget timeline for the city. In addition, there's just some minor wording changes. But the sort of major, more significant changes relate to the arbitration process and sort of the scope of the decision making that the arbitrator has. And one of the major changes is that if the negotiation process results in an impasse, which then sends the negotiation to arbitration, where a third party comes in to make a decision. That's how the code is currently written. One of the amendments says that the decision of the arbitrator then goes to the council for the council's review, and the council can vote to approve or not approve or modify, sort of do what it sees fit with that arbitration decision. And so, I'm not sure if that's fully understood by all who have read this, but that's the change there. It doesn't get rid of bargaining. It doesn't get rid of arbitration. It does make the arbitration decision subject to review by the council before it becomes binding. And that is not a new concept. That is part of the bargaining laws that are in place in Montgomery County, Prince George's County, Anne Arundel County, Howard County, and Baltimore County also, in different forms. In some of those jurisdictions, the an impasse results in explicitly non-binding fact-finding that then goes back to the parties to continue negotiating. But also in many of those jurisdictions, for some places for just general government employees and some places for all employees, including police and fire as well, an arbitrator's decision then goes before the county council in those counties for their
review and their discretion to vote to adopt or not adopt or modify, to fund it, not fund it. And that is the same structure that's in place with the state. The state does not have binding arbitration for its public employee unions. The state university system is the same way. Baltimore City, where I do the labor work as well, has non-binding fact-finding for its general government employees. So that change that's been proposed here is very much within the mainstream of these large jurisdictions within the state of Maryland that have bargaining. And again, as a starting point, I think it's only half the counties in Maryland actually have bargaining rights for public employees. Half of them don't have it at all. So we're already on that sort of side of the line here, and we're proposing a change, or the legislation is proposing a change that would remain very much within the mainstream of all these bargaining laws. And then just the other major, more significant change that's proposed here relates to the scope of the authority of an arbitrator in an impasse, and the amount of money, essentially, the amount that the arbitrator sort of has to work with in fashioning the arbitrator's decision. And that modification here, in that respect, what that does is it sets a limit that the funding that's been proposed in the mayor's proposed budget for compensation increases will set the upper parameter of what the arbitrator can decide if the impasse results in arbitration. The arbitrator doesn't have to adopt the mayor's proposal as it is, doesn't have to adopt the way that money is allocated, but cannot exceed that amount of money. And the idea there was to essentially ensure that there's some predictability and stability between the budget process and the bargaining process, that the bargaining process is not going to yield a result that is at odds with the budget that's moving forward through that process at the same time. So that's really, I just wanted to give that overview of the changes. The other change that's again a little bit more technical, I think I saw someone in the public comment mention it earlier, was the way that the arbitrator will be selected in an impasse. That we did sort of clean up that language to make it clear that if an arbitrator is to be selected, it's from a pool of a list of 7 arbitrators, which is a common structure among the bargaining jurisdictions in the state, and it has to be someone who's a member of the National Academy of Arbitrators, which is the body that you can only become a member of if you've arbitrated a certain number of cases, to ensure that we get someone with expertise and experience.
I wonder if I would like to propose that we go by change and discuss, because I think there's some things in this that may be okay, and then there's some things that aren't going to be. I think it's more than an all or nothing. You know what I mean? I think we could probably work on changing the things that we may agree on, and look at things that we know we're not going to agree on. I wonder if it would be worth going from change to change and doing that, as it's worth the time. I think the very first change comes under
Line 82.
Line 82.
Regular's been added.
And what would be regular part-time?
Would you like me to jump in on that, or?
Yeah.
Sorry. Okay. So the idea there, and I think this was, I know that in the actual negotiations over the last couple of years, the city and the union representatives had an understanding that we were sort of assuming that word would be there. Regular means that it's a part-time employee who actually has a regular schedule, not someone who's considered a casual employee, or a standby employee who doesn't actually work a regular schedule, or who can work by choice. When they're called, they have the ability to say, yeah, I'll take that shift, or no, I don't want to take that shift. So the idea here is that, and this is sort of standard in labor statutes and labor law, is that Bargaining includes full-time employees, obviously, but would also include regular part-time employees, those who are on a regular schedule, whose terms and conditions can be set through the bargaining process.
Council, comments? Why couldn't we put regularly scheduled employee? No?
It probably does not pose a problem. Regular is the term that's sort of conventional in labor law, but if it's more understandable to use regularly scheduled, I'm sure that would probably have the same effect.
Council, what do you think?
Let's keep it simple.
Yeah.
It's regular, I would say.
All right. Our next line is 135.
Right, so we added a definition of wages and benefits here, and that's to make clear, because that term is used later on in another amendment in line 200, and so we wanted to make sure that there was a clear definition, that the scope of that term included everything that was listed there, so that there wouldn't be room for misunderstandings or disagreements when the parties are actually in bargaining, that whether wages and benefits, everyone knows that it, would assume it includes salaries and base wages, but to make sure that it's understood that it includes all these other forms of compensation that would be under negotiation, stipends, differentials, and so on and so forth.
Council?
And Dan, I believe the purpose for that was because the change in binding versus non-binding was for wages and not everything else that's in the agreement. Is that correct?
Yeah, that term does get picked up in some of the other changes as we will go through them. So I think that was why we felt it was important to have that definition.
So basically, you put this in here to clarify what they were negotiating for?
No, it's just the definition, because that later comes up. So it's just adding a definition so that when it's in the
Consistent.
yeah, when it's
What you're
in
referring to.
yes.
Council? Yes, no?
I mean, I want to see where it's used later, so that's why I was.
We're gonna come back to line- let's come back to line one.
Let's come back to this before we.
Agree.
I want to see how that term is used, that's all.
Okay, so line 200?
Yes, so that falls under the section that's at the bottom of the prior pages where it starts. It's the section of the code that lists the employer rights, which is a common standard element of any public sector bargaining statute that preserves the prerogatives of the municipality as the employer. And so we had that list that's already in the code. The addition of line 200 really, so this goes to one of the two sort of major points that I referred to in my overview, which is that in order to foster and sort of set some parameters to ensure some budgetary predictability, this makes it a employer prerogative, an employer right that's not negotiable. It's not subject to negotiation. It makes it the right of the city as a party at the bargaining table to determine the budget for expenditures attributable to increases, if any, in wages and benefits for employees covered by this code. So this is saying, this is part of what I refer to as saying that the ceiling on the funds that would be directed towards labor cost increases, wage and benefit increases through the negotiating process would be determined by the city, by the city in the bargaining table, in the bargaining process. So that makes it an employer right to do that. It takes it outside the scope of negotiations. So what's still subject to negotiation would be within that sort of funding parameter. Would it be a step increase? Would there be a step and a half if that fits within the funding? Would there be a COLA and a step? Would there be an increase to a night differential or a particular stipend? Those allocation of the way that the money's allocated would be subject to negotiation, but the total cost would be set by the city in negotiation, for negotiation.
Council?
Didn't we already make an agreement with this, with the union?
In the labor agreement?
And the attributes and the determinant of the budget for the expenditures, how much the wages we're gonna give them? Didn't we make a agreement?
Last
with that?
year, right, for the coming
Okay.
year.
This is for
last year.
future years.
So this is not gonna hinder the union now?
Not this year's agreement, no. Not the last year. Next year, yeah.
But this takes it out of their hands, and I don't agree with it.
And I don't either, because I'm like this. If we want workers and we want people to work, and we want good workers, we have to pay them. I mean, we have to pay these people. Did you hear the young man just say that earlier that they're working understaffed? They're overworking, underpaid. Come on, we can't be this. We just can't be this ignorant to the fact that we don't understand. I'm like them. I'm not going to work for no pennies. I'm not going to do it. I'm just not going to do it, and I don't expect for them to have to do it. But some of the jobs that they have to perform, some of the duties, they shouldn't have to go through that. And we can't keep a person here for the life of me. We can't keep people employed at fields or nowhere.
Nah.
And this is the reason why.
I'm going to be real clear, because I've made this clear to administration prior to this conversation we're having here. I'm not going to vote for or move forward anything other than the time change, because that's the only thing that makes sense about anything.
Thank you. Me
So
too.
I'm just going to let's cut through the chase instead of going through this, because
Me too.
unless somebody has something that they want to
I'm
really
not
deep
going
and
for it
make an
either.
argument, I don't see. Look, we worked our rear ends off to get this done. Mm-hmm. It took a monumental effort.
And they
get this
trusted
done.
us. To get this.
And like Angela was just pointing out, we have employees who are living in their cars, and we're talking about limiting their ability to negotiate even more. I mean, no. I'm just going to say this. I understand the logic of the time change. That's fine. That's cool. I'm cool with that. Anything else? Nope.
Nope, me either.
Nope. I'm not moving it forward. I'm just not.
I'm done.
I'm not going to sit through this.
I'm not, because
It's
in order for
getting
us to
late,
get
and I'm not
workers,
gonna do this.
we're going to have to pay the costs.
So,
Council, do we have consensus to move this forward?
No?
Okay, the answer is no.
I think,
Angela,
Thank you.
real quick though, the time frame portion that
If you want
Yep.
to bring this back and with the time frame change,
Yep.
and that's the only change, I'm
That could be fine.
Can I ask Ashley a question, though? The time is all wrapped into this. Do we have to come back with that, or can they actually modify to move forward? Because again, this is a work session.
It's up to them, but yes.
Can we-
If you want to come back with this, with all the other changes removed and keep the time change in, I'm fine with that.
Yep.
Real quick, just so I understand,
Coming back to work session?
We
or
could-
Legislative session with just that change?
but we could come back to a legislative first reading,
Correct.
knowing that the
Good point.
consensus is the time change, because that's the important part
I mean,
right now.
That's what I'm good with. That is everybody else good with that?
Plus the regular addition for the line that we already discussed, just to be clear.
Which
So the-
line?
It already says in there that there doesn't
82?
include seasonal employees. So I mean, I don't understand why adding the regular would be. the same? Are there part-time, non-regular employees that are not seasonal? I mean, I don't think.
City council counts.
Seasonal and casual are different categories. So
Okay.
regular
Yeah.
Okay, yeah, that
That could be a person work
that's-
35 hours.
fine. That's fine. But like, I'm not.
So can I, just so we can be clear, it will move forward for the next legislative session with the changes to line item 82, and then those limited to 434 to 441 for the time.
Yep.
Yep.
Okay, so that's what I will do.
Thank you.
So I just want to make
Thank you.
one closing statement on this conversation. The whole reason we're here is not because we're not trying to pay people fairly. The issue that we had last year was we ended up committing to another $1.5 million roughly dollars that we don't have revenue to support, that we had to take from surplus to supply. That is a fiduciary challenge that we are for our taxpayers. My problem with it is we had some one-time revenue that we were able to count, but it's not going to be returning next year. This has not got anything to do with how we view our employees, how we value their work, and how we're trying. This is an accounting matter. This is a budgeting issue. This is a predictability problem. So yeah, I'm more than open to coming back and bringing it. But I think we need to really get a little closer to what we're really talking about here. We're not. This isn't a. And there, the person that you're referring to that's living in his car is I don't want to get into the personnel matter, but there's no reason for him to be living in his car. Let's put it that way.
Well, here's the bottom line. We're going to move it forward with the time change to the legislation session. The council's already spoken. We've already voted. We're moving it forward with that. And
I have one question with terminology. Should down in 503, 517, or 450, where it says mayor's budget to adopt, should it be proposed budget and say city and not mayor?
Yeah,
he's the one that proposes the budget.
Yeah, but
He's the one
proposed
who
it to us,
budget.
and then it is a city budget that funds this.
I understand it, but it's the mayor.
They use the mayor's budget.
They use the mayor's budget. When we get done with it, then it's the city's budget. But he's the one who proposes the budget.
Okay. So not adopted, then, you want to make sure it's mayor's proposed budget. Instead, wherever it's been adopted, it should be proposed. It's just a technicality, Ashley, if you'll just clarify that. Not now, but just whenever you read it.
Again, I'm sorry.
That would be are you talking about the addition to line 503, or where are we?
503 it was the terminology when I read through it. Where am I?
That would be something that was proposed, but since council does not have consensus with that addition, I think it becomes a moot point.
Yep,
Yeah.
it's a moot point.
Okay, all right, thank you.
Yep.
Okay, we're moving on. Thank you very much for your time. Sorry for the lateness of the hour. We just have one last thing. I think Mr. Bode is here. We're going to be talking about gas blowers and dog ordinance.
Bringing up the rear.
Sharon, Councilwoman DeShiel, were we still doing the dog one? I thought,
Sort of.
okay,
Yep.
just making sure
Just sort of. Just sort of. Thank you. Thank you, as city administrator, Mr.
Okay, thank you, Mr. Boda.
Good evening.
Good evening, good evening.
Before we get to it, happy Thanksgiving. I'm back. All my holes and ruptures have been sutured and I've
bless your
recovered.
heart.
Nice,
So,
nice. So no turkey will be leaking.
No, and
Yes.
I still can't lift more than 15 pounds.
Okay.
Yeah, yeah.
We're good. And
20-pound turkey is out. 20-pound turkey is out.
Mike's here because his quarterly evaluation's coming up.
Okay.
So it's a close monitoring of.
Okay, I see.
I'm going to make sure he's right.
Okay, very
He's right all the
good.
time.
Very good.
All right, so we'll start with the gas blowers within the city limits. So there is currently in section 8.20.020, which is entitled Prohibited Noises Enumerated. If you go down to K, under, yeah, it's section K. And I'll just read it so we know. It specifically states blowers, the operation of any noise-creating blower or power fan or any internal combustion engine, the operation of which causes noise due to the explosion of operating gases or fluids between the hours of 11 p.m. and 7 a.m., unless the noise from such blower or fan is muffled, and such engine is equipped with a muffler device sufficient to deaden such noise. So we currently have that on the books. I don't know if we want to discuss any changes to that or any.
Okay.
PM to 11
It's 11 p.m. to 7 a.m. My concern is the fact how loud the gas blowers are and the edgers, and I don't want to put any landscaping company out of business. I mean, that's how they make their livelihood. But my intent or hope with input is that it's not at dinner time. It's maybe, early in the morning until late afternoon.
Sure.
And possibly not on a Sunday or something like that. I just think they're so loud and they're just so obnoxious.
Sure.
And I've had people come to me with the concern, can we tighten this up?
Sure. So one of there's a couple of things that we could look at. We could, in the code, if we jump up to section I, which is construction or repairing of buildings, there's a, maybe one of the thoughts that we discussed is if we move it to be consistent with construction. So, which basically construction, the demolition, alteration, erection, repair of any building other than between the hours of 7 a.m. and 6 p.m. on Monday through Friday, and between the hours of 9 a.m. and 6 p.m. on Saturday, and then between the hours of 12 p.m. and 6 p.m. on Sunday. So that is what the code has with regards to construction, which again, it's similar noises when you're talking about power equipment, circular saws, other things. It's those noises are all similar. So we could look to have K mirror I as far as times, if that's something you all would like to
I
consider.
feel times are important. I think they're just my feeling. Anyway.
Another recommendation with regard for the summer hours. Because when you're talking about landscapers and stuff like that, sometimes they're limited when they can do their work based on the weather and so on. So if you have daylight hours in the summertime till 8 o'clock, that may be reasonable to think that somebody would be out there cleaning up a yard or doing that type of landscaping in the summertime in the daylight hours. Okay, so you may extend that in that area, but we were thinking about that noise enumerator as far as with construction and so on. That's the limit that we're trying to do, and we do enforce that. Again, it's law enforcement noise violation. Hey, this guy's out here blowing his blower at 9 o'clock at night, which shouldn't happen. You would think that anyone would be doing that, but.
That was going to be my question. What does enforcement of something like this look like?
So it would if it was after hours, all the noise ordinances after hours are enforced by the police department.
So I definitely think this is a conversation we probably should have with Chief Mindshine just to understand his staffing issues and what this may look like if he were to. I would hope it's not a lot, but I would like to probably bring him in on a conversation. And I can have that conversation. Sharon, I think maybe you, and Chief Mindshine can also have a conversation.
It's just been brought to my attention by a handful of people in my district, and I said I would bring it up in all fairness to them. So.
Okay. Next item, I guess, is the dog barking. Chronic concerns. We're not trying to pass the ball here, but again, the animal control is the ones that enforce the animals, and any dog barking that's under. So that would of course be under the police department's purview as well. So I don't feel comfortable making any recommendations on that because we don't enforce that.
Well, I talked with the animal control people as well as Chief Mindshine, and we talked about, this was a concern in a couple of areas, again, my district. And we decided, unless there's more input from the council, that we'll look at this, in greater depth and see if it needs to be tightened up, because if a neighbor calls animal control and then animal control can only do so much, then I think it's our duty to give them the power to be able to assist the neighbors.
Sure.
With an issue like this. So if that's okay with the rest of council members, I think that's where we move forward on this one.
Well, are we talking about dogs that are outside barking?
Yeah.
Or
Numbers
inside
of-
barking in an apartment building.
Yes, yeah, but it's any noise that interferes with the neighbor's
Right. Quality of life.
quality of life.
Yeah.
But, I mean, the code right now is written in such a way they can actually impound the animal. Okay? And I don't know what worse you could do to somebody other than taking their pet after a number of citations and so
Yeah.
on. So I just feel like, the code's pretty well written as to that enforcement for those folks. It's very similar to our trash regulations and nuisance properties. It's after a series of complaints and, citations and so on. But it's very clear as to, if I got to come back here the third time, we're going to have to impound your dog.
Okay, so you feel that it's already clear enough? That's why I thank you both for coming, because reading through that noise, I'm like, oh my God.
I feel like it's very clear.
Okay.
It's just whether or not you want to advocate, for enforcement all the way to that level, and that's, that's the challenge. Okay, if you
It's
get those-
neighbor responsibility.
Exactly.
Yeah,
And
okay.
You don't want to create an issue, but
Right.
you just have to respond appropriately. Hey, here's your corrective action letter. The next one is going to be a citation. The next one's another citation, and then if I have to come back a third time,
Okay.
we're going to have to impound your animal.
Okay, all right.
So it's a progressive thing, and it's up to the individual owner of the animal or of the property to take care of that
Okay.
issue. But it falls under the same thing as far as enforcement for feces, not maintaining control, food and water, all those things, for animal control. They take all those things into account when they come for a complaint or, a recommendation.
Okay.
So they have to take all those things into account. It's very lengthy. It's 27 pages code. So
Yeah.
it's not something that they just, they decided to do this. It's very lengthy.
And we get a lot of those complaints, and our officers work well with the animal control officers. So there's a good symbiotic relationship there, that they're constantly, probably 3 or 4 times a month, working with animal control when they come across stuff or complaints that we receive. So it's and sometimes the complaints are tied to multiple issues at the property, and that happens to be one of them.
This is,
So-
yeah.
so it's,
This is also
we've
the
come
same
across a
property,
few of
I think,
those.
that has that issue. Yes.
Yeah, and the feces thing is something that we
Yep.
do get involved in,
Yeah.
as far as
Yeah.
not maintaining it and so on.
And I know which property you're talking
Yeah.
about now, so.
Okay. So, thank you for your time.
Thank you.
And thank
Yeah.
you
You're
for the
welcome very
information.
much.
Appreciate it.
For your
Thank
hard
you.
work.
Thank you.
Thank you.
Your hard work.
Always appreciate y'all.
Before we wrap up, thank you very much. Any public comments? They have to be, I think they're commenting on just the agenda items. Do you have any comments about the agenda items?
Thanks, Mike.
All right, Michael Langford, 1026 Arthur Court. Couple things. I guess one of the strangest things is the conversation about homelessness is just kind of like a perspective lens. The government doesn't actually house people or have any legal obligation to. I understand people feel that there's an ethical obligation we have as individual human beings to help these people, but there is actually no law or obligation. And even more importantly, the government doesn't have the means, like financially, to actually provide what people want. So That's a very strange, conversation for me, because the government doesn't provide housing for most people, and they can't provide permanent housing for most people, and it's just not going to happen materially, or financially. So it just seems kind of really driving home for, I'm not quite sure what, as an outcome. The conversation about the labor, again, the government's work is in fact technical. I feel like going through and parsing through the particular contract is part of what that entails. So I would just recommend actually looking at the contract. If people need clarification or to be caught up on speed of why a particular terminology is used, there is a reason. I mean, that's why counsel is here, the city attorney. So, and then the last thing is, on the annexation, it is just, again, just this bizarre Lynchian world that we're living in, where instead of listening to people are going on and on about not listening to the people in the union on the labor code, and at the same time, then watching, the person leading the council completely disregarding the city employee's recommendation on the annexation. It's like you're talking about, you're grandstanding to say that we need to listen to the labor and the people who work for this city, and then you're completely disregarding what the people who work for the city say. I mean, it's just hypocrisy. So that aspect is just listen to the city employees whose job it is to have the public interest at heart. That's what you hired them to do. And then over developers whose only private interest is to make money. It does not matter what he says. He's a salesperson. It is crazy to bring these people in as though they are an advisory. They're just here to tell you what they want. I understand the decision of just wanting to move forward with business or whatever that was, that you all decided on this evening, but it's like, this is the process. That is the nitty gritty. That is the point where you have the ability to hold people accountable and be like, hey, we don't really care about you telling us that what he's going to build with townhomes is not going to be affordable. I'm going to tell you exactly what's going to happen because I work in this industry. I'm not lying to anybody because what my vocation is. They're going to be turned into commercial rental properties, and everybody is going to be paying $2,000 to $3,000 for brand new construction, regardless of the zoning that you pick. Any kind of idea about affordability is just a sales gimmick. Stop listening to developers. Listen to city people. Thank you.
Thank you. Next.
Joe Schiaffino. I shared with the council an article from Bloomberg about the gas blowers. I just happen to have 3 neighbors on the left side that at least once a week, full bore, dinner time. If the city doesn't want to completely ban them, the suggestion for limiting the hours, maybe from 8 to 5 or 7 to 5 or something like that. Breakfast, most people are gone, but dinner hour is really important. And there have been times, sitting in my house that you can't even have a conversation. It is so loud. And the other consideration, which was brought up in the article, are the poor employees. Most of the people in landscaping business are immigrants. They're not paid a huge wage. They're the one who are having the damage to their hearing, breathing in noxious fumes. It's a big issue, and a lot of places across the country are taking it up and are realizing it. And I'm glad you're considering it. And like I say, worst case, if we limit the hours, that would provide some relief. Thank you.
Lana Foley, city resident. Wasn't going to speak again, but I was just sitting here, and after listening to the work session, I wanted to say apparently a lot of words. I think we need to remember that people are no longer homeless when we give them a home. I find people want to ignore the people and just get them out of sight. We have so many empty buildings, and I love the idea of finding places that could be a resource to help give people a helping hand. There was a couple of mentions about taxes this evening, and I really find it sad that we have become a country and a community that we are all so desperate to hold on to our quarters that we aren't willing to share some pennies. I live in the city, and I only wanted to live in the city, and I worked and have worked in the city. I've heard people say, I don't want to live in the city because I don't want to pay taxes, or I only want to live in the area where I have city services but don't have to pay the taxes. I understand that so many have become desperate, and it has made our mindset switch to hoarding our resources. To constantly hear the complaints about taxes being paid locally and in our state We've become people who don't want to contribute to society, or that we only want to contribute to things that we deem as helpful for us personally because we are all in need. People are struggling and have become angry at the people in our country, bless you, that receive help because they feel like they are doing everything right and still aren't getting by. I understand that mindset. I see our upcoming bills for this coming year and I don't know where the money's going to come from. The more people that help spread that burden, the easier it is to carry the weight. We only have to give pennies when we all participate in creating a dollar. I don't have a solution, but I know that we need to be active and come together because we really have the ability to do so much for each other. As far as the annexation, I worked in construction for 7 years, new construction, and to hear the constant suggestion of building smaller homes will always be more expensive if you don't build up. Why would somebody want to spend more money to get a smaller home? It's why you stopped seeing so many ranchers in the 80s. It helped add square feet for less per square foot cost. With single-family homes, every individual foundation adds so much money to build. You will create affordability when you spread the expense over multiple units, and also if you build up. I'm not sure why there is such a negative mindset on townhomes. They can be part of a housing chain that I spoke about earlier this evening. And as far as density, nobody wants Salisbury to turn into Delaware. But there are people who are desperate to get out of the grips of landlords. And I don't think it's fair that there's people who are comfortably in their homes that aren't willing to help move stuff forward. And also, I spent my daughter's 8th birthday listening to a gas blower for hours.
Good evening. I guess I do gotta introduce myself. My name is Amber Green, and I serve as the Youth Homeless System Improvement Specialist for the Maryland Department of Housing and Community Development. You heard from my colleague earlier today when she was able to give you an outlook of what's going on and talking about permanent supportive housing. Now that I work stateside, I want to kind of get some grounding here and just remind folks that Salisbury is my home. And now that I am closer to data and closer to resources, I come back home a little bit more eager to make change. Because far too often when we talk about homelessness, youth still get left out. Not once has anybody mentioned anything about youth homelessness. And so I thought I would dig into my resources and my stories, and I pulled one out because youth need their voices heard. And I want to put respect and not reveal their identity, but I want to share something that was said to me. I never slept outside, so nobody believed I was homeless. But I didn't have anywhere to go. I stayed in 5 houses in 1 month. Each time I thought I'd get to stay, somebody's uncle came home or somebody's mom got mad and I had to grab my stuff and leave. They were 16, trying to finish high school and just trying to survive. They told me how they would wake up every day exhausted, not because they were out late partying, but because they spent the night pretending to be asleep lightly on someone's couch so they could flee if the energy shifted in that house. They said, I kept my shoes by the door because I never knew when I'd have to run. We spent hours tonight talking about our unhoused community, and not once have we mentioned the 16-year-old that's sleeping under the bridge. Not once have we talked about the 4-year-old and the 3-year-old that's walking down the street at 2 a.m. because their parents are in the hotel doing whatever they need to be doing, but they're unhoused. We're not talking about the mislabels of people. We're not talking about the shelters and the policies. We are arguing about personal opinions and not sticking to the facts. So I just want to remind everyone that Amber Green is still here in Salisbury, but I'm now on stateside, and I can come in and do TA, but I've been saying this stuff for 10 years, and I'm going to continue to say it in 10 years. Youth cannot be forgotten when we're talking about homelessness. There are babies literally dying in the cold. And I want to do a fact just really quick. The permanent supportive housing for the city of Salisbury in 10 years helped 48 people, not 14 to 16. Thank you.
Thank you, Amber.
How you doing? Harvey
Doing
Evans.
good.
I'm a resident of Salisbury, Maryland. I've been here since 1984. I originally came to talk about affordable housing, but I was going to talk a few minutes about leaves. I spent all day today. I have a leaf vacuum, a dump trailer, removing leaves. It's my responsibility as a citizen to get rid of my leaves. I got 3 properties in the city. I cut the grass with a zero-turn mower. One takes me 15 minutes, one takes me 5 minutes. I don't use a leaf blower. When I used to push, it took me an hour, so I was making more noise. And I do it when there's no dew in the grass and when I can fit it into my schedule. So I don't understand, I get the point. I live across the street from the mansion. Every Thursday morning, 9 o'clock, they pull up, and we got a whole crew of guys making a bunch of noise. That's just, I don't know if you guys maybe live in too nice of neighborhoods if they can afford all these landscapers. But anyway, my thing was, I came here to address Ms. Gregory, her affordable housing, $300,000 for a house. I just lost a house on Livingston Street. I almost bought for $150,000. It was a 4-bedroom house. It was really nice, hardwood floors. There's tons of houses all over town that don't cost that much money. When I moved into my house, in 1989, I paid $85,000. My neighbors down the street have been there since the 70s. They paid $40,000. They thought I was crazy to pay $85,000. I looked it up. I was home watching TV. If you have a $300,000 house, you put 5% down, you're going to have a $1,600 mortgage payment, $1,600 to $1,700. I think people are paying that rent for some of these high-end places. So, I grew up in a row house neighborhood in West Baltimore. My parents lived on the corner. My uncles lived around, and we had a corner house, and my parents' mortgage was $100. They thought that was like a big deal. And the most exciting thing is we didn't have to walk the lawnmower around the alley to do the backyard. We got to do the whole yard. So it's all relevant. 300, there's houses today that are going for crazy money, but, as the great Mark Reeves says, the best time to buy a house is today. They don't get any cheaper. So I don't know. I understand people need affordable stuff. I work on the weekends. People say have a nice weekend, and I'm out on a lacrosse field walking back and forth in the rain and the snow, getting screamed at. So, people have to make sacrifices if they want to buy a house. You got to save money. You got to put it down. You got to get a mortgage and pay the mortgage, and over time it gets smaller. That's all I had to say. Thank you.
Mike Peronsky again, City of Salisbury resident. Couple things from the work session. Primarily, I wanted to echo Ms. Jackson on her enthusiasm for the North Prong Park project. This is not just a park that we're pursuing, it's an environmental justice issue, as she rightfully brought up. This is a post-industrial area. And I think the new park should honor the industrial history, but also take extensive measures to restore habitat in that area and to provide ample green space for the community. And I'm just very concerned with the way the project's unfolding so far, because in the grant application to DNR, we included the $1.7 million for the brownfield remediation as part of the project costs, and then the $500,000 grant from the state of Maryland, but we didn't list any other budget numbers in there. So it's truly my hope that we invest a lot more than $500,000 in this park from the state. I would like to maybe invite the planning team to the next Parks Committee meeting to give us a detailed overview of their thoughts on the budget. And maybe that includes someone from the administration. We spent $4.5 million or more on a less than 1 square block park. And I think this neighborhood deserves an equal amount of investment for this property. We invested, just to kind of give reference, like almost $300,000 in a games park just outside of the mayor's office. So, I can't find any other budget numbers. So if anyone else has a budget number, let me know. And I think we also need to really think about the design. The DNR application had the completion date as 2030. Design process for 2 years. Basically, we're in it right now, and I would like to know what the design process looks like. And I think the Lake Street community needs to be at the forefront of that. And then I just really quick, Mr. Shield, when we were doing the homeless presentation, I used to work in West Baltimore doing social work. I went to Our Daily Bread on a weekly basis with youth, but I just can't underscore the involvement of the faith-based community in providing every type of service to the homeless. Catholic Charities primarily, Jesuit Volunteer Corps, and I just wanted to mention a couple names down here. We have the Henson Foundation, the Guerreris, and the Purdue's. They've contributed significant dollars to many organizations on the shore. It'd be great if we had a center that was providing wraparound services to the homeless with one of those names on it. So
Thank you. Thank you very much. Okay, anybody else before we wrap up? Any council comments?
I do. I know there were some people here, I wish they had stayed, about Pemberton Manor. I've been working with Pemberton Manor and working on Pemberton Manor for 10 years. 10 years to be exact. I'm one person working by myself. I have gone over there, I've called the company, the corporation that owns this place. They lie in New Jersey. And they refuse to come in. And this is what I'm talking about when we allow developers to come in our city and build. And we don't hold their feet to the fire. They just pass it on to somebody else, pass it on to somebody. They patch it up just enough for the government to inspect and go on. This place it's over 50 years old. This place has been a wreck for over 10 years. Something needs to be done, but what I don't want to happen is that this place is actually condemned and the residents do not have anywhere to go because we're going to be out of probably 1,000 people or more being homeless. So we have to be very careful how we do things, and we don't want to put people, and I know Lana's one of the ones that's on the committee helping, and I just want it to be known that it's not like this place has been neglected, because this place has been, I've spoken to numerous of residents over there and told them exactly what we were told in the first meeting, and I said in the first meeting, and they won't do it. And it's not all because of retaliation either. It's not, and I can guarantee you it's not all because of retaliation. I know a lot of people over there, but I'm going to leave it there. For instance, but they need to come up front if they're having problems. They need to be forthcoming and come to these meetings and put this place on the spot. I did it with River's Edge. River's Edge had a lot of problems over there when they first were built. And I had 25, 30 people in here at a meeting until we got it straight. And we did get it straight. I haven't had a complaint from those people. If they are having complaints, I'm not hearing them. And I know that's who they called was me. And I brought Cherie Sample Hughes, which was a delegate from the state, and I brought Ernie Davis, which was for the county, because they have money coming from the state, county, and city. Next of all, I've done help with 4 renovations. No, one, two, three, 4, probably 5. So don't ever think that I don't want to make sure this place gets done. Because I just helped do a renovation at Riverside Senior Home, fought for that for years. They finally got it. COVID came in and just kind of levied some things out, so they didn't get to do it until just lately. Gateway Senior Home, same thing happened to them, but they've been renovated. Mitchell Landing, fought for that. Asked the mayor to let it go. Sharon and I said, let it go. Just let it go and let somebody take care of this property, because the city did not take care of this property at all. That's been renovated, newly beautiful. And then we had the village at Mitchell Pond. where I reside, that's getting ready to get their renovation. So I have been fighting for all these places to get renovated, and I'll stand 10 toes down with those people. But don't ever think that I am not working in my community for Pemberton or any other housing, because I have been from day one, as soon as my feet hit the ground. I want to relay a message that WIDAC has said they wanted to know their role with the youth of the city and would like to have an ordinance or resolution presented or come up with a resolution saying what their job is, because they're kind of like confused on what they're supposed to do. And they don't want to step out of the boundaries of the city and cause a liability.
I think there is a resolution.
No.
There is
Well,
not?
if it is, they don't know what, they don't know.
All right.
I was just there, so they don't really know. And I just want to make sure that this is mandated and in order, because we don't want to step out of the line and cause a liability for our city youth.
We are working on general boards and commissions, and we are working on that.
Thank you. And then again, tomorrow, November 25th, 2025, at the Save-A-Lot parking lot, the Salisbury City Police will be hosting their giveaway, their Thanksgiving giveaway. I think it's 500 roasters they're giving away along with entire meal. And it's going to start from 2 to 6. So make sure you get the word out, spread the word so that people can come. And we had it, Sergeant Hitty and I, talked about the time, because a lot of times people who work don't get to get there. And a lot of people who are working are the ones that are really struggling because they don't get the assistance they need. So if you need it, come and get it. It's there for you all. And I just want to say we won't have a meeting until after Thanksgiving. Everybody have a very blessed and happy Thanksgiving.
Comments?
Yes. Kudos to the fire department for doing their display on burning a Christmas tree that catches on fire, and also frying a turkey. Trust me, that was frightening. They did a wonderful job with that display. The zoo, Wild Vibes, keep supporting the zoo. It's an amazing place. It really is. Operation We Care packed 650 boxes to be sent to our servicemen. And we did it in how many hours? An hour and a half, maybe, with a huge community in Mardella showing up to just box it. The Henry Hotel is something I want you to look for. It is a docudrama.
Yes.
And it is about the Henry Hotel in Ocean City. And they are showing it at different places. It was part of Third Friday, this past Friday night, and it's great to watch. And if you do have any questions, Michael Langford can answer that and give you the dates for the next showings on that April 9. Thoroughly enjoyed it.
It was really nice.
It was very
enlightening and educational.
Exactly. And lastly, HHEH, we opened last Sunday night. The 5-month cold weather shelter is behind the Seventh-day Adventist Church on John Deere Drive. If you would like to volunteer, do you want to bring food, things like that, we have 34 men that have a safe place to sleep and eat for 5 months. So, thank you.
Thank you.
I'm going to keep it brief because it's getting late, very late. Just want to remind everybody that it is cold and flu season. It has just made a pass through our house. So please, if you are out in public, consider wearing a mask to protect yourself or others. Also, make sure you're getting a flu shot. It's not too late. You need to get one. You do not want the flu. Fortunately, that's not exactly what hit us. I'm not quite sure what it was, but it was, well, let me put it this way. I was the only one that didn't get sick, so it was definitely a man cold. All the women in here understand. But yeah, please take care of yourselves. Be careful. You're going to visit family. You're going out of state to visit family, or if people are coming to you, just practice, safety when it comes to illnesses and that sort of thing. So, happy Thanksgiving, guys.
All I'm saying is have a wonderful Thanksgiving and enjoy. and be thankful and grateful. And with that, the meeting is ended.